Welcome to Getting Understanding. For those of you who don't know, I'm your host, Dr. Darrell Ellis. Well, what are those risks? Testosterone replacement, not unlike estrogen replacement therapy in women, does have an increased risk of producing blood clots in your body. It does that because as it stimulates your level of testosterone to go up, it also stimulates production of red blood cells from your bone marrow, causing increased viscosity of the blood or thickening of the blood as your hemoglobin and hematocrit levels grow higher and higher and higher, sometimes to a point where it actually produces what we call polycythemia, or hemoglobin levels above what is considered to be the acceptable range. That ultimately increases your risk of forming blood clots, and as such, also increases your risk of strokes and potentially heart attacks, as well as blood clots in your extremities or in your lungs or pulmonary emboli. If your testicles are already struggling to produce testosterone, then you shut them down further by being on replacement therapy. If you decide you come off of that replacement therapy, you usually do not regain the ability of your testicles to produce endogenously, even at the level they were before you started the replacement therapy. And then lastly, and perhaps in some cases, most importantly, it stimulates growth of your prostate gland. If you have an enlarged prostate, or if you have a prostate that already has some undetected abnormal cells or precancerous cells, and then you get on testosterone replacement therapy, it can increase the risk of the accelerated growth of those abnormal cells, increasing your risk for prostate cancer and or proliferation of prostate cancer that may already be there will spread to the bones as a metastases. So there are definitely some potential risks, and those need to be discussed with your healthcare provider. If you choose to take exogenous therapy, whether it be in the form of shots or creams or pellets, then you need to do so under the care of a primary care or a specialty provider like a urologist so that you can get the proper monitoring laboratory studies. You should be getting regular blood counts to make sure you've not developed a polycythemia. You should be getting regular prostate-specific antigen checks to be sure that your prostate is not growing inordinately. And you should also be making sure you're getting those testosterone levels checked regularly so that you stay within the normal physiologic range and you don't get super high levels, which further increase the risk of all the side effects that I described earlier. So it's really important. I mean, it's something that can cause a significant amount of morbidity, if you will, or a sense of mal-ease or sickness in men as we get older. And at the same time, it also can lead to other problems like the depression that we talked about. So it's something that needs to be addressed, but there's more than one way to skin every cat. So discuss it with your healthcare provider. Seek non-pharmacologic interventions first, and then if that isn't working for you and you really are suffering with severe symptoms, look at other alternatives. If you want to know more about this specific topic, make sure you put some comments into the comment section below. If you're not subscribed, I'd love for you to hit that subscribe button. Also hit the bell notification so that we can notify you when new topics are introduced. And lastly, I would love to hear from you in terms of additional topics that you would like to hear about so that you can be informed, and then it is for me to just bring out topics that I think are important. Because ultimately, the purpose of this channel is to inform the public about medical issues that most affect you.